For shoulder pain, typically patients don't want to move the arm, so unnecessarily delaying surgery can lead to increased stiffness, which sometimes needs additional treatment, weakness of the muscles around the shoulder, which can make recovery more difficult as well. And then, of course, the prolonging unnecessary pain and functional limitations by delaying surgery would be an additional risk. So for an example, for a chronic rotator cuff tear, if a patient has gone through physical therapy and injections and medications, it's unlikely at that point that their pain would go away if they've been having those treatments for 3 to 6 months. So delaying surgery would delay their functional recovery and then increase the time period that they have pain as well. For some rotator cuff tears, they can get bigger over time. It's also possible that they become impossible to repair if they're not repaired early enough, and so that would change what surgical options the patient has. Since we see a lot of sleep disruption with shoulder pain, it can have a significant impact both on quality of life and the patient's health. We all know that sleep is really important to our overall health, so if patients aren't sleeping, that can have negative impacts on their health as well. We're seeing that patients want to be more and more active in their 60s and 70s, and shoulder pain can certainly prevent them from participating in hobbies and sports such as golf and tennis, spending time with their family, especially if they have young grandkids that they'd like to play with. And we also see many patients now working into their 60s and 70s, and shoulder pain can also disrupt activities at work as well.